Your dog's torn his ACL ligament, that's the main knee ligament. And you're wondering, could this actually heal without surgery? These are 5 steps you can do at home to heal your dog's torn ACL ligament without surgery.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
What is the ACL? ACL, that stands for anterior cruciate ligament, and it's the primary ligament that is stabilizing the knee. So it runs from the femur, the big bone up here, down below to the tibia. It goes from the medial portion of the lateral tibial crest, which is in this side here, and runs this way. It's this large, thick, fibrous tissue, this really important ligament that prevents this cranial motion. So the femur here, the big bone on top, it almost wants to slide forward. And what that ligament doing is it's keeping it stabilized, so it's not sliding forward along the tibia. Diagnosis of an ACL tear, it's going to see if you can elicit a drawer sign. And what that means is you're firmly holding the femur, you're firmly holding the tibia, and if you can get cranial motion of the lower bone, the tibia, in relation to the femur, especially it's substantial, that's a positive drawer sign, and that's where you see if a dog is torn his ACL. Your veterinarian may have said you need to have surgery. Your dog needs surgery or he won't heal. Especially if you have a large or a giant breed, or you have a dog that's overweight. Not everyone can afford surgery. Not everyone wants to have surgery. Clearly there are risks of surgery, so it does make sense you're exploring non-surgical options. This one study, they specifically looked at non-surgery versus surgery in large and giant breeds that were overweight. I mean, these are big dogs you'd expect to never heal without surgery. And these are ones where most veterinarians, and myself included in practice, would say, you have one option, you need to have surgery. Turns out that wasn't really so. The study, they recruited 40 overweight or large giant breed dogs, and they compared the surgical ones versus the non-surgical outcomes. They found that 2/3 of the dogs in the non-surgical group, they had successful outcomes. Yes, surgery was better, especially for these large and giant breeds. Imagine the kind of forces in this large or giant breed dog that's overweight. He's just expecting his knee to do so much. But to imagine that a non-surgical option could result in 2/3 of these guys getting better, I mean, that's huge. Another study, they looked at different sizes of dogs in terms of a range of different weights, not just large and giant breeds. And they found that on average, for animals that were 30 pounds and under, the majority of those, over 90%, they can successfully heal without surgery. Over 90%. So meaning just because your dog has torn his ACL does not mean that you have to mortgage your house so you can pay for that $10,000 TPLO surgery. You can look at non-surgical outcomes. Yes, it's going to take longer, but you know what? There's a whole lot of hope there. And there are hundreds and hundreds, if not thousands of dogs who've torn their ACL, and pet parents like yourself have healed their dogs at home following some of these steps. Number one, you got to modify your dog's activity because you're not going in doing surgery to restabilize that knee. So what we need to do is have your dog produce all this scar tissue where there's minimal movement of the knee, and then that's going to provide the stability so then your dog can have his normal-ish active life. So for the first 2 weeks, your dog is strictly on a leash, and that's it. I like to break it up into 2-week segments. So for the first 2 weeks, your dog is strictly confined. All he or she is doing is being on a leash. She may even have to be carried out onto the lawn to go to the bathroom. It's outside going to the bathroom and back inside, and that is it. Your dog cannot run, cannot jump, cannot chase. And this activity modification, this goes over at least a 16-week period. So you're looking at least a 4-month commitment. Anytime they've got that jumping up force, that's really straining the knee, that could break down that scar tissue. They can't stop and start. They can't chase a squirrel. They cannot chase anything. And there's no sudden stop starts. You can't throw them a ball. For that next 16 weeks, your dog has to be on a leash. And long term, that's what's providing the stability. That is what is going to give the strength of the knee so you're healing your dog's knee without having surgery. Then every 2 weeks, there can be a modest increase in activity. Perhaps having him or her walk for 5 minutes just around the yard. They're not doing stairs, they're not jumping up, they're not putting any type of unusual force that's going to really ask the knee to compress itself and restabilize it. And then in general, every 2 weeks, you increase the amount of activity by adding in 5 minutes. So at week 3 and week 4, they're walking for 5 minutes twice a day. Week 5 and 6, we're going to double that time, 10 minutes twice a day. But you need to gauge it for how your dog is, how he or she is responding. If he or she seems tired, it seems like she's starting to favor the knee again, then obviously you're going to cut that time down. You're not going to walk her so long. There aren't any really set guidelines, but when you looked at that study which showed so many of these dogs, these large, giant breed, overweight dogs recovering without surgery, it was activity modification. Number 2, weight management. You want to be able to feel a loose covering over your dog's ribs. Tula, who's been pretty darn active lately, and don't you like her little hoodie? She just ran 13 miles a few days ago. This dog is 12 and a half years old and she is so fit. That's all I feel, just a loose covering over her ribs. And that's what you want in your dog, especially if your dog is going to heal without surgery. If your dog's overweight, he or she needs to lose weight. And because you can't exercise your dog, you really need to focus on diet. So number 1, get your dog off of this high carb kibble. You need to get your dog on a much higher protein diet, minimal carb diet, such as this, the prepackaged frozen raw. You're going to need to be feeding your dog less. Your dog is not going to be active for at least the next 4 months. You're going to need to minimize treats, but if you are feeding your dog a treat, it needs to be a high protein, no carbohydrate treat. Mighty Wolf here is a great option. It's a nice, super high protein dog treat, which Tula loves. But instead of getting 10 a day, you're only going to get half twice a day. You need to be modifying the amount of food your dog's getting. I've talked about a number of different supplements which may help with weight loss, colostrum, probiotics, etc. But in truth, there is one simple remedy which I've seen many pet parents share and say, okay, this is one thing that made a difference. It was giving their dog this guy green tea. An easy way is just make a cup of green tea, thinking about a quarter of a cup per 20 pounds of body weight daily. Or you can just add a green tea bag, if I can open it here, to your dog's water. And guess what? Instead of getting water, they're getting green tea water. Okay, Tula. An easy way to increase their metabolic rate, potentially help them lose weight. And that's what we need to do. We need to have them lose weight, at the very least, maintain their weight if they're a healthy weight to start when they've injured their ACL. Number 3, meds to reduce pain, inflammation, help support the cartilage. When your dog's first torn his ACL and he's extremely painful, it's completely fine to get on a conventional NSAID, such as this NSAID, meloxicam. But there are many other natural options. First, get your dog on a good quality joint support supplement, one that includes glucosamine, chondroitin, MSM. And then other nutrients that can decrease pain and inflammation. The essential fatty acids, which are in here. 95% curcumin, a great natural anti-inflammatory and painkiller. Dr. Jones's Ultimate Canine Advanced Plus. It obviously doesn't need to be my supplement to just make sure your dog is on a good quality joint support supplement. CBD, the non-psychoactive portion of the cannabis plant, it is a great option and a great alternative to the NSAIDs. I find many of these dogs, you can just use the CBD as opposed to Medicam, etc. Controlling pain and inflammation is key if your dog is going to heal without surgery. Typical CBD doses, 3 milligrams per 10 pounds of body weight, and I'll be giving that twice a day. Here you go, 2 drops. That's your dose. 6 milligrams. Yum. Good girl. 95% curcumin, the active ingredient from the turmeric plant. It's also a really important anti-inflammatory and painkiller. And it's a really good one to have your dog on, especially when you're trying to heal them when they've torn their ACL. And then number 2, you want to ensure you're giving a good quality supplement that is potentially more bioavailable. A good option is this guy here. Dr. Jones's high absorption, 95% curcumin for dogs and cats. This is a really good option. Then lastly, don't forget the topical treatments. I personally have had a few different injured ligaments and tendons in my day, fairly recently actually. So I've been putting a lot of effort into topical treatment as well. I'm finding that's been really beneficial. I think it's really important. We're just neglecting it in our animals. So a really good option here is number 1, this super inexpensive product called DMSO. You can get it at any natural health store. It's rapidly absorbed into the skin. In fact, it's absorbed within seconds, and it can go right into the joint. So instead of trying to systemically get inflammation down by giving a pill or something, we're directing where the source is. We're putting it in the knee. DMSO is a great option. I've talked about it before, especially in combination with CBD. So number one, we're putting 2 to 3 drops of the CBD on the inside part and the medial part of the knee. Okay, Tula, there's the CBD. Then number two, we're opening up the DMSO. I'm going to put about 4 or 5 drops of the DMSO right over top of that CBD and the inside part of your knee. Ta-da. If you don't want to absorb it, it's best to use gloves. It's safe to absorb it. It's just not everyone wants to be absorbing it. And then you're just going to rub it on the inside of the knee. It rapidly absorbs in through the skin. And it's a great way to provide local topical pain relief. You can easily and safely do that twice a day. What do you think, Poodle? DMSO and CBD. A couple other things you may want to consider that are specific veterinary treatments, but what they're doing is helping support and rebuild the cartilage. Adequine, a glycosaminoglycans, and it's providing the building blocks for cartilage. It can be given via an injection to your dog once a month. I use that fairly often in practice. Many dogs responded. Then there are some new intra-articular therapies. We're actually injecting particular substances right within the knee. What we're trying to do is stimulate knee healing. We want that cartilage to regrow. We want to deal with all that secondary inflammation and have your dog starting to weight bear and starting to want to use that knee as soon as possible. One which I've seen to be particularly helpful is called PRP, or platelet-rich plasma. Here, your veterinarian, they're going to get a sample of your dog's blood. They're going to spin it down in a centrifuge. They're going to separate a number of different cells, and they're going to be left with platelets and plasma. They're going to then draw that up into a syringe, and they're going to be injecting that into your dog's knee. And what they're finding is many of these dogs are responding really well to PRP therapy, to the point that's making a big difference whether they're going to walk or not, or they're going to have that ACL heal properly. Other treatments include stem cell therapy. It could potentially provide the building blocks to help rebuild that torn ACL. Then there can be just laser therapy, because once again, we're trying to decrease inflammation in the knee. We're doing that with the effect of some of these high energy waves. We want to be able to get your dog weight bearing as soon as possible. And the sooner we can get him to start to weight bear on that knee, because he's comfortably doing that, because he's not in pain, we have such a much better chance of having a positive outcome that is non-surgical. Number 4, rehabilitation therapy. Think of physio for your dog, but you're being the physiotherapist. So the simplest thing, and I've talked about this on the past and we'll link to some of the previous videos, is you are, number 1, doing things called PRM, passive range of motion exercises. You're gently supporting your dog's knee, as we're doing here with Tula. I'm holding her hock joint here, and we're just going to gently extend, and we're going to flex the knee. Your dog is not necessarily using all those muscles. They're going to seize up if you don't extend and flex them. And by doing this, we're producing joint fluid. It lubricates the knee, provides natural pain relief. We have a much better chance by just doing that. Do that 5 twice a day. Increase that up to 10 is fine. So that's where we're doing a couple big things. We're producing joint fluid, building up some of those muscles. Number 2, you can look at massaging the muscles below the knee, the muscles above the knee. Just imagine these big quadricep muscles attaching above the knee, attaching to the kneecap or the patellar tendon. Imagine some of the vastus medialis, these hamstring muscles that are doing really important parts to support the knee. But imagine if they're not moving, they're just going to atrophy and get all like seized up. You're going to massage these twice a day. You don't have to be a massage therapist. Just slowly work the muscles, doing it comfortable with your dog. Likewise, focus on some of those muscles below the knee joint. The ones along the front here, the ones along the side of the tibia, and the ones here along the back of the tibia. The third really important physio exercise, if you can do it, is hydrotherapy. Slightly more aggressive physio is not going to start till at least 4 weeks of healing. By that period of time, that 4-week period, there's a moderate amount of scar tissue. We know there's some stability within the knee, but then we now want your dog to start to go through some of the more range of motions, the extension and the flexion. Small to medium dog, you can use a bathtub, that's great. 5 minutes twice a day in the bath. You just set him in, and it's partly supporting his body. It's all you need to do, and have him just sort of extend and flex that knee. If it's the summertime, then great, and you have access to a lake or some body of water, it's an awesome option. As the muscles get stronger, they're also better able to support that knee. So it's all a big package. Decreasing inflammation in the knee, providing nutrients are going to help decrease the inflammation, help rebuild some of that cartilage, and then also work with the surrounding muscles so they can get stronger again. When that all happens, then you're going to have a dog that's starting to heal. There are a number of specific canine rehabilitation therapists, people that have hydrotherapy pools, and if you have that as an option, great, consider that. How often should you be performing this rehab therapy? Passive range of motion exercises, you can be doing that daily. And you don't need to stop doing that. It's just such a simple, easy thing to do at home. Some of the more advanced physio where we're looking at, say, swimming in a pool, the hydrotherapy, ideally you're looking like twice a week if you can. It's a great option. At the very least, commit to once a week. But just doing that just can really make such a big difference. The massage, that's something that should be done daily as well. But these rehab therapies, they weren't even part of that study. So by you doing these rehab therapies, you're actually just improving the chance of your dog able to recover without surgery. Number 5, and I think this is pretty key, it's a knee brace. Knee braces, they can do 2 things. Well, number 1, they're stabilizing the injured knee. That makes sense. More stable knee, your dog has an increased chance of healing. I've had my share of knee stuff lately, and I've really seen the benefit of having some form of brace or support in the knee. It makes a big difference. Very same principle applies to your dog. But the second thing, and a really big key part, is a high percent of dogs, if they injure one knee, they're more than likely to injure the other knee unless you do something to help support and prevent that. If your dog has torn her ACL, as Tula say, she's torn her ACL on her right leg, she's always got it hiked up, she's putting all this excessive force hopping on 3 legs on her left leg. So guess what can happen? She can tear ACL on her left leg. But if you're using a brace, for instance, then you're supporting this leg, she can start to weight bear earlier. And some of the well-designed braces, there also can help support the good leg that's not yet injured. I think it's a really, really good option. I really like the OrthoDog cranial cruciate knee brace. So this is the knee brace that we use, and then we use it with Michael's last dog, Heather. She'd torn her ACL. The knee brace is something that can be put on immediately. As soon as your dog has torn his or her ACL, get that knee brace on to help support the injured knee and help also support the non-injured knee, decreasing the chance of secondary rupture. In the study, I start out by referencing the big 3 things they focused on as number 1, activity reduction, number 2, weight loss, number 3, medication to help support the cartilage, decrease pain and inflammation. Those are big 3 key things. So at the very least, you focus on those. Then obviously number 4, look at something, physical therapy to help support your dog's injured knee. Adding in number 5, like something like a knee brace, I really think you have a really good chance of helping have your dog heal without surgery. Thanks so much for watching this edition of Veterinary Secrets of how you can help your dog heal his torn ACL without surgery. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.